Hi, I'm Dr. Neil Schultz, and this is Viewer Question Week at both BeautyRx and Derm TV. Welcome to the May 2013 BeautyRx Live, where on live streaming video, I'll answer your questions about BeautyRx skincare products and any related skincare issues. BeautyRx skincare products are the same patient-proven and award-winning products which have been giving my patients more beautiful, healthier, and younger-looking skin for over a decade. And they're based on the fundamental use of 3 essential skincare products or ingredients every day. Sunscreen, of course, antioxidants, and the real workhorse, which is exfoliants. It's because BeautyRx products are now available to the public over websites and spas and different retail establishments. I'm now making myself available to all of you to answer your questions about these products or related skincare issues so that you can all be in touch with the person who created these products and who can help you out with any questions you may have. So if you have a question, go to BeautyRxLive.com, use the chat box, put in your question, and with live streaming and over live streaming video, I will answer as many of your questions as I can. First question today comes from Susan. She says, by the end of every summer, I have new brown spots I never had before. What can I do to prevent them this summer? Susan, that's a great question. And of course, prevention is much better than treatment. But the bottom line is you have exquisitely sensitive pigment cells called melanocytes. So from the summer ultraviolet radiation, you are activating those melanocytes and causing the brown spots to form. I would like to assume that these are happening despite the fact that you're using sunscreen every day. You need to use sunscreen not only every morning, but you need to reapply it every 2 to 3 hours during the summer when you're outdoors and after swimming and sweating because it comes off. So if you're not doing that, then simply using an effective sunscreen with an SPF of between 15 and 30 with UVA protection will most probably prevent those spots from coming. If you are already doing that, and despite that, you're getting the spots, then what I'm going to suggest is reapplying your sunscreen even more often and try a chem-free sunscreen. Try a chem-free sunscreen based on zinc or titanium. I have a feeling that they can protect even a little bit better than traditional carbon-based sunscreens. And also, if there's any hormonal component to your brown spots, which is also called cloasma, melasma, or when you're pregnant, the mask of pregnancy. Traditional carbon-based sunscreens sometimes will not protect you as well from the ultraviolet-induced pigmentation as will the chem-free. And we have a question from Mike. Does wearing a baseball hat every day to help protect my skin from the sun because I have thinning hair? Yes, I'm just making sure I have that right, Mike. Sure it will. If you have thinning hair, obviously the top of your scalp is a horizontal surface, and therefore when the ultraviolet light hits it, it hits it perpendicularly, which is the most harmful way ultraviolet light can impact on your skin. So anything that will help protect your skin is going to be helpful in preventing sun damage. A hat is obviously an SPF of 10 million as long as it's a tight weave to the hat. If it's an open hat with mesh, it's not going to be quite as effective. If you just have thinning hair and you're not bald, it's very hard to put sunscreen on. So yes, the best way to do that is with a hat. And even if you want to wear a hat that has mesh around the sides, take a handkerchief or a piece of tissue on the top so the mesh on the top is not quite as penetrable to the ultraviolet rays, so we get just a little bit more protection. And a question from Beth. And just to remind you, this is I'm Dr. Neil Schultz, and this is BeautyRx Live for May 2013. If you have a question, go to BeautyRxLive.com and just type your question in the text box, and I'll get to as many of them today as I can. So Beth says, does the sun have any effect on my moles? Beth, it certainly does. If you have unprotected sun exposure to your moles, especially the flat ones, we think that high impact, high intensity exposure from the damaging ultraviolet of the sun is one of the things that causes those moles to become abnormal. Now, it doesn't happen over one summer. It can take 20, 25, or even 30 years for those moles to go from normal flat freckles to what we call dysplastic or precancerous moles, and then more time after that to become melanomas. But I believe, as do many other dermatologists, that many melanomas come from abnormal precancerous moles called dysplastic nevi, and that they in turn are induced by short duration, high intensity sun exposure, like the kind that causes you to turn red like a lobster and be chilly that night, or even to give you blisters. So by all means, as you know, I don't tell people not to go in the sun. I tell them how to protect their skin in the sun. Use sunscreen every day on all sun-exposed areas, whether you have moles there or not. Joan asks, is 5% glycolic acid with a pH of 3.5 effective for acne-prone, sensitive skin, and how much free acid is in it? Thanks again, as always. Jean, for that type of calculation, usually we use charts, but I can tell you that it's going to be about 2% free acid at a pH of 3.5, because at a pH of 3.8, it would be 2.5% or 50% of the glycolic concentration. And at 2%, glycolic is going to be helpful for both the prevention of acne in terms of preventing clogging, as well as helping acne acne bumps, pimples, clogs go away sooner. Question from Joel. I sweat a lot. Now that the weather is changing, I'm concerned my sunscreen won't stay intact for that long. Is there anything I can do? Joel, the obvious answer here is knowing that you are a sweater, which will obviously take away your sunscreen quicker, is half of the solution, because then you know you need to reapply your sunscreen even more often. With the new FDA labeling for sunscreens, sunscreens are no longer labeled waterproof. They are labeled water resistant, and some of them will say water resistant for up to 40 minutes and some for 80 minutes. I would choose a sunscreen labeled either of those, water resistant for either of those periods, as sunscreens that are going to have more of what we call substantivity, meaning they last longer on your skin. They are less apt to be sweated off and to come off with any kind of liquid, whether it's swimming in a swimming pool or just from sweating. So yes, those are the two things to do. Get one that demonstrates water resistance and is labeled that way, and those labelings are very accurate today, as well as reapplying more often. So again, I'm Dr. Neil Schultz. This is May 2013, BeautyRx Live. If you have a question, please go to the BeautyRxLive.com chat box, type in your question, and I will get to as many of them today as I can. We have a question now from Christy. I like tanning. Of course, with sunscreen, I'm going to start that again so it's in proper context. Christy says, I like tanning, of course, with sunscreen. Is there anything I should avoid during the summer prior to going out into the sun on a more regular basis? Laser hair removal, exfoliation, anything? Very good questions. Certainly, exfoliation, if you're using sunscreen, is not a problem. Laser hair removal, if you're having a laser treatment, I think it's probably important to try not to get too much sun from a week before the laser hair removal until a week after the laser hair removal. But it depends which machine you're using, and you should ask the operator or whoever is doing your procedure which machine they're using and whether there's more sensitivity before the procedure or after the procedure. Certainly, anything that strips off superficial layers of skin is going to make you more sensitive. So even physical exfoliation like microdermabrasion, microdermabrasion rollers, may have an effect. Waxing, which is going to pull off some superficial layers of skin. Bottom line is, if you're using an effective sunscreen and you're using it regularly and reapplying it, as I've mentioned earlier today, you really shouldn't have a problem. But, of course, don't forget about the shadow rule. Shadow rule says if on a sunny day your shadow is shorter than you are, that's the time when the sun is most harmful. And be careful about the amount of sun that you get during those times, even with your sunscreen, if you're doing any of these other things that could possibly or potentially predispose you to increased sun sensitivity. One more thing, certain medications make you more sensitive to the sun. So if you're taking any prescription medications, check with your doctor and make sure they don't make you sensitive to the sun. Paula asks, are there any topical products for shadows on the face? Also, what is there as topicals that makes lines and wrinkles less noticeable besides AHA and sunscreen? Well, the first place I would go for that part of your question, Paula, is moisturizers. Because as moisturizers cause your skin to absorb moisture, whether it's based on emollients or humectants, as your skin absorbs moisture, it has to swell a little bit. And that swelling will actually fill in fine lines and wrinkles. In terms of topical products for shadows, we're really talking about two types of things. One is makeup. So if you have a shadow is dark. Lighter colored makeup than your skin color will make that shadow look not quite as deep. And that's a professional makeup trick that people use on television and for photography and movies and things like that. And one other product is are products that are called reflectors. And reflectors have certain minerals in them, like mica, which are very shiny. And when the light hits them, the light shines right back. So it makes areas that have these products on look much brighter. So these products, the reflector products, are used in areas that normally have shadows. We'll get to a question from Harriet in just a moment. Harriet says, I saw your BeautyRx Brightening Complex. Can you tell me more about it and whether I should consider using it this summer? Well, the Brightening Complex is our non-hydroquinone bleach, and it's based on 5 botanical extracts, which in 4 different places in the process of creating melanin interfere with melanization. So it interferes with formation of the brown pigment that we're trying to avoid, whether it's in general or in spots or blotches. So the reason that I like it is not because it's hydroquinone free. There's nothing wrong with hydroquinone. Unfortunately, hydroquinone has gotten a bad rap. It's an effective ingredient, and I use it in prescription strength for my patients all the time. But I can't use prescription strength for the products that I make available to the public. So I particularly like Brightening Complex because of the synergy between these 4 different botanical extracts in helping to reduce the formation of the extra brown. And in terms of whether you should consider using it this summer, only if you regularly get brown spots and want to reduce the formation of those brown spots, or you already have brown spots and want to prevent them from getting any darker. But if you're somebody who normally doesn't get brown spots in the summer, then you don't really need the Brightening Complex. And thank you, Harriet. That's an interesting question. Michelle asks, what's helpful for huge pores? Michelle, when you say huge, that's kind of challenging. When I think of enlarged pores, I don't think of huge pores. I think of medium-sized pores, which of course is very subjective. When you say huge, it sort of makes me think maybe those are scars from old pimples, and particularly ice pick scars, which are very, very difficult to manage with topical products. If we're talking about regular enlarged pores, medium-sized and large pores, small and large pores, then it is going to be a combination of keratolytics, which means things that dissolve keratin, to help dissolve the dead cells that are getting stuck in the pores. And keratolytics are products like salicylic acid and glycolic acid and benzoyl peroxide. And also products that help clean out the pores and help clean out the stuck, what we call inspissated sebum that forms almost like this concrete with the dead cells. So we're talking there about cleansers, even cleansers that are particularly marked for acne-prone skin, and alcohol-based toners and astringents. Now, there's one more thing that you can use, and this is a place where I love physical exfoliation, and usually I'm partial to chemical exfoliation, but this is a place where particulate particles in cleansers help to get into the pores and help to clean out some of those clogs. But for them to be most effective, the pores have to be opened a little bit for them to get in. So the best time to use those products is at the end of the shower. You use your regular oil-removing cleanser at the beginning of the shower, then in the course of the shower. The steam and hot water and hot vapor helps to steam open the pores, and then the very last thing you do is use one of these granular cleansers very gently on your nose. Now, I recommend granular cleansers with polyethylene beads, which are round, and regardless of how hard you scrub, you probably won't hurt yourself, as opposed to granular cleansers that are based on crushed nutshells, which can be very hard, very angular, and can actually cut your skin. So it's that 1, 2, 3 punch of keratolytics in the form of exfoliants, then using cleansers and toners to help dissolve out the sebum, which is mixed in with the dead cells, which is the keratin, and then lastly the physical exfoliant in the form of a granular cleanser. We have a question from Anna who asks, I know the purpose of a cleanser, but I'm still a bit confused about toners. Can you help? I'm sorry, that's Anne, not Anna. And think of it this way. If you want to get the job done in terms of cleansing your skin and removing oil, dirt, debris, and dead cells, you can do it by either using one product, which is very strong, or two products that aren't quite as strong, but synergize with each other and help each other out. The problem is, if you take the first route, which is just the very strong cleanser, the cleanser may be so strong that it may be too harsh and may irritate your skin. So by getting the toner to help with the cleanser in succession after the cleanser, to help remove all of the impediments that you're trying to get off your skin, oil, dirt, debris, dead cells, you will get a synergy in cleansing without an additive effect of potential irritation. And there's one more thing a toner does. Sometimes, as we're rinsing our cleanser off with water, not all the cleanser comes off, so not all of the oil and not all of the debris comes off. So the toner / astringent will help remove anything that didn't, any of the residual cleanser and debris that your water didn't take off. All right, so let's take a look at a question from Paul. This isn't necessarily skincare product related, but how do I find a good dermatologist in my area? Paul, I think it's a very important question. I think that the best way to find a good dermatologist in your area is by personal recommendation. Speak to 2 or 3 friends, business colleagues, or your regular doctor, your internist. For women, perhaps your gynecologist, and ask them who they recommend. And if you're new in an area and don't know anybody to ask, then you go to this website called aad.org, which is the website of the American Academy of Dermatology. And there's a box on the right upper hand corner on the home page where you put your zip code, and then it asks you what radius do you want, 5 miles, 2 miles, 15 miles, depending whether you're urban or rural. And it will give you a list of board certified or board eligible dermatologists, their qualifications, their web pages, their addresses, both e-addresses and actual addresses, and that can help you find a qualified dermatologist. The last question that we'll have time for today comes from Rachel, and she says, I have some dry skin next to my nose that I just can't seem to get to go away. Anything I can do? Rachel, I'm going to bet that you're using a moisturizer, because what you're calling dry skin is probably flaky skin, probably right over here. And the interesting thing, Rachel, is that it's probably not dry skin. It's probably dandruff. Places that are particularly prone to dandruff are the areas next to the nose, between the eyebrows, even in the eyebrows, behind the ears, as well as your scalp. And dandruff, which is also called seborrhea, comes from overactivity of oil glands, which causes inflammation of the skin. The skin gets a little red and swollen, and that inflamed skin gets shed prematurely. So the cells that normally fall off too small to see fall off in larger flakes, which is what you see as flakes that you're construing to be dry skin. So you want to treat the seborrhea if you have dandruff, or seborrhea-dandruff. If you have dandruff in your scalp, whatever shampoo you use for your dandruff there, bring it down to your nose. once or twice a day and just gently massage it in for 20-30 seconds and rinse it off. If you don't have scalp dandruff, then get an over-the-counter antifungal. And you don't have a fungus, but certain over-the-counter antifungals are very effective for helping this, particularly one called ketoconazole, Ketoconizole. Then you can always try an over-the-counter 1% hydrocortisone cream, but don't use it for more than 3 or 4 days. If it hasn't helped in 3 or 4 days, then it may be time to see your dermatologist for a prescription. So that's it for today. Thank you very much for all of your questions. Please keep sending your questions in, and every week, every day to Derm TV, as well as joining us for the next BeautyRx Live. On tomorrow, we will have a combined Derm TV viewer questions, where we'll be answering questions from both our YouTube subscribers and our regular DermTV.com website. So we'll see you tomorrow, and I hope to hear from you soon. And please wear sunscreen.